special populations. So sometimes we do have clients that present with certain conditions that mean that you need to tailor the training specific for their needs. The first one that we've got is high blood pressure. Now, the main thing to think about here is not to put their feet or their weight or any weight above the heart, so that you're not taking that blood away from the heart. So that would mean that they wouldn't do specific exercises like you wouldn't have them doing chin-ups, you wouldn't have them doing a push press. Okay. The other thing you need to think of is their breathing patterns. Okay, so you monitor them closely, watch them at all times. A good way to do this is by doing a talk test. So talk to them. If they can talk back to you, you can get an idea as to how rapid their breathing is. If they're looking pale, if they're looking really exhausted, and ask them, and if they do present with any symptoms of looking like they're not coping with the exercise, then just pull out of it, have a break, and then take it from there. The next thing is lower back pain. Certain exercises you want to avoid, okay? You want to make sure that they're always supported in their back. You don't want them to do exercises that are going to strain their back. So, for example, you wouldn't have a person who has lower back pain to do sit-ups because it's going to strain their back. If you're going to do abdominal exercises, you'll actually get them on the ground with their back on the ground so that it's supported at all times and work from the legs, okay, rather than doing it the other way around. You'd always, if you can, give them a seated support when doing exercises, so sit them somewhere where there's something flush against their back so that they've got that support. And lots of stretching before and after exercises to make sure that it's nice and loose and warm so that you don't do any more damage. We want to strengthen that back, we don't want to make it worse. The other thing is knee injuries. So knee injuries, you wouldn't do any impact exercises, you would do everything static. So no jumping, no running, okay, anything that involves those two things. A bike is a good exercise to be doing when someone has knee problems. They can strengthen their legs without the impact. And the other thing is, to do static squats, for example. So you keep the feet firmly planted on the ground and you're squatting down rather than actually doing something where you're jumping or you're kicking back. Anything you do, you want it to be on level ground, so no unstable surfaces, because that's going to throw them off balance and it's going to put extra pressure on their knees.